To provide a safer environment for our members, Kaiser is enhancing between-case cleanings in our exam rooms and patient areas. This video is intended as an overview of cleaning procedure for the clinical assistants. Using the approved disinfectants, the clinical assistant will wipe down all high-touch surfaces. To maximize use of the wipes, the clinical assistant will fold wipes into 4. This allows the wipe to have multiple wiping surfaces, which will prevent cross-contamination. After the patient has left the room, the clinical assistant will work clockwise around the room, wiping high-touch surfaces from cleanest to dirtiest. This routine will help assure that the clinical assistant does not miss or contaminate areas when cleaning. Always be sure to wear proper PPE and practice hand hygiene before and after cleaning processes. High-touch surfaces are those that have frequent contact with hands. In patient areas, these high-contact surfaces require more frequent disinfection. Pure One is the first surface cleaning and disinfectant to receive an EPA registration for its efficacy against biofilm. In conclusion, learners should be familiar with expectations of cleaning exam rooms between patient use. Have an understanding of high-touch surfaces that require routine cleaning and disinfection. If heightened disinfection is needed, clinical assistants should call EVS for terminal cleaning. We thank you for your time and attention to our members. Your service is greatly appreciated.